What are the symptoms of blood clots in the lungs? We're going to be talking about the different blood clot symptoms that you need to watch out for if you have a lung condition. Firstly, what is a blood clot? A blood clot is a condition when blood coagulates in one place inside the body, mostly in your lower leg. However, sometimes it can form deep within the thigh muscles, pelvis area, and even the lumbar region too. The symptoms of a blood clot in the lung are very severe and should be treated immediately. This condition can be life-threatening, resulting in a stroke or a broken limb. Often, the clot forms in the leg or arm. Occasionally, they can also form in the brain as a result of a blow to the head. Regardless of how severe the symptoms are, it is important to get medical treatment as soon as possible. The symptoms of a blood clot in the lungs can be intense. The most common symptom is shortness of breath. Some people may experience diarrhea or vomiting, while others may only experience mild or moderate chest pain. The clot will most likely travel to an artery in the lung. The severity of the symptoms will depend on where the clot has formed in the body. If a blood clot is found in the lungs, it is important to consult a doctor immediately. There are different symptoms for each condition you might have. However, key signs that indicate the presence of blood clots are swelling around the eyes or face due to fluid accumulation under the skin, pain around the chest area, especially if you have breathing difficulties, and if you have lost any weight without cutting down on your food intake. Swelling around the eyes or face due to fluid accumulation under the skin. As a blood clot separates from the blood vessel, it starts to block smaller blood vessels in the lungs, resulting in breathing difficulties and chest pain. In severe cases, blood flow is reduced by blood clots that result in a lack of oxygen reaching vital organs such as the kidney and brain, which could harm them badly. It may also lead to a coma and death if not managed properly. If you have any of these symptoms, call your primary care provider immediately. In severe cases, you may need emergency surgery, but this option is not always available. Depending on the size and location of the clot, you may need to undergo an ultrasound to determine the exact location of the clot in your body. If the bronchial artery has been affected, this procedure can also help prevent future episodes of pulmonary embolism. Other symptoms of a blood clot in the lungs include coughing up blood. If you experience any of these symptoms, it's important to visit a physician as soon as possible. Someone with a history of pulmonary embolism may have other problems, which is why it's important to see a doctor as soon as possible. A blood clot in the lungs can be dangerous. If left untreated, it can lead to heart failure or even death. If you're experiencing these symptoms, you should seek medical attention immediately. A pulmonary embolism in the lungs can be life-threatening, and you should take urgent action to find out what the underlying cause is. If you've had a previous heart attack, you should call your doctor right away. The diagnosis of a blood clot in the lungs is based on the location of the clot. If the thrombus is in the leg, it can cause swelling in the entire arm. In some cases, the blood clot can even travel to the lungs. In such cases, a doctor may administer a special drug to dissolve the clot. If the clot is in the lungs, it is called deep vein thrombosis. When a blood clot is in the leg, it can travel to the lungs, where it may block an artery. If this happens, it can prevent the exchange of oxygen and carbon dioxide and can cause tissue death. Symptoms of a blood clot in the lungs include chest pain, fever, and heart attack. These can be the same as the onset of a heart attack or may appear much later in the disease. It is important to be aware of the symptoms of a blood clot in the lungs. These include the following: excessive weight, a history of venous thrombosis, and sudden, unexpected death. A pulmonary embolism can also affect a person's ability to breathe. Therefore, it is important to seek medical attention if you suspect a blood clot in the spleen. If you experience any of these symptoms, it's important to seek medical attention as soon as possible. You may have a pulmonary embolism, and the longer you wait for treatment, the more likely you are to suffer from complications such as organ failure or death. Don't take chances with your life by waiting too long. This could lead to serious consequences that will affect not just you but those who love you most in this world.